Good day, everyone. My name is Orli Tori, and I am a partner at Triventures, a multi-stage venture capital firm that invests in opportunities that transform healthcare. During the last 20 years, I held different executive roles spanning across several industries, including healthcare, consumer health, and digital health. Today, I would like to share with you why we believe that we are at the verge of a new era of delivery care and how it poses a vast opportunities for entrepreneurs and investors. The global demand for healthcare products and services will keep growing significantly. For example, in the US, which is the world's largest market, healthcare spending mounted to an unbelievable number of $4 trillion, and health expenditures already account today for 18% of US GDP. So healthcare is a big market that keeps getting bigger. Why is that? The world population is getting older, but not necessarily healthier. Aging populations, higher rates of chronic health conditions, and exponential but costly advances in digital technologies will continue to push global healthcare expenditures upward. The senior population of the United States is expected to grow up to 5 times faster than other segments of the population, and seniors are expected to represent approximately 20% of the population by 2030. Yuval Noah Harari predicted already at the early stage of the COVID pandemic that many short-term emergency measures will become a fixture of life. That is the nature of emergencies. They fast-forward historical processes, and decisions that in normal times could take years of deliberation are passed in a matter of hours. The COVID crisis has positively impacted the global digital health market and its growth in 2020. The growth is mainly due to the rising adoption of digital health services to obtain real-time health information amidst the pandemic. The healthcare authorities were highly focusing on promoting telemedicine, remote medical monitoring, all to avoid the virus spread. So how did COVID affect telehealth? You can see the amazing numbers. There was an increase in telehealth claims across the US of 4,000%, and CMS issued 80 new codes for telehealth with the same price as in-person visits. And it seems that consumers liked it, with 90% saying they will access telehealth in the future as well. So we believe that consumer convenience, together with the capacity for providers, suggests that virtual care is here to stay. The unprecedented global health crisis of COVID-19 put a spotlight on a broken system with low incentives for prevention and promotion of good health. We are seeing the largest health insurance coverage crisis ever, with 70 million persons without medical insurance. Providers in the US are facing deep financial losses that are estimated with over $300 billion in 2020. The industry is looking for ways to deliver effective and scalable healthcare while keeping people away from hospitals and clinics if possible. In today's rapidly changing healthcare landscape, the need for fast digital transformation is crucial in driving operational efficiencies, enhancing patient care, and keeping costs low. And yet, while it is clear that digital transformation is a priority for healthcare professionals, fewer than 10% of the hospitals in the US have executed a fully digital strategy. It is known that markets that are vulnerable for disruption generally have a few risk factors. Gross inefficiency is an example, high costs, powerful players, and outdated ways of doing business. I cannot think of a better description to the healthcare market. Having significant implications on healthcare system now and post-COVID, we are on the tip of a health tech revolution where the lessons learned from this virus and approach to tackling it today will become embedded for years to come. We can use technology to do things better, faster, and cheaper than what exists. Technology, and specifically AI, is driving force in healthcare, bringing new players into industry. As is evident from the $20 billion purchase of Nuance Communication by Microsoft earlier this year. You know that Nuance is a speech recognition pioneer, and already nearly 80% of US hospitals are using Nuance to create patient notes by dictation. The fact that the healthcare market is ready for disruption has not escaped the eyes of the leading companies of the world. In 2020, for the first time ever, 9 out of 10 leading companies in Fortune 500 have healthcare activity. Companies that no one imagined will have a healthcare play, like AT&T and Amazon, are now in the game. In fact, Amazon is predicted by some to become the world's fastest growing healthcare company. The financial markets also reacted, and we see a shift from traditional M&A-based exits that used to dominate the path to liquidity for healthcare investors to more and more IPOs of unicorns. In fact, in the last 18 months or so, we saw more digital health unicorns IPOs than in the last 5 years. The abandonment of cell phones plus universal access to broadband internet could dramatically increase access to reliable medical information, digital support, and interactions between patients and clinicians over digital media, thus freeing up clinicians, especially nurses and community health workers, to function at the top of their capabilities and extend high-quality care into every community. Moreover, I think that adding to our treatment protocol social determinants of health will allow us to get individual-level interventions leading to improved outcomes. So digital solutions and data are becoming increasingly important in our healthcare today. They can drive patient-centric innovation and demonstrate value to payers, patients, and carers. We in Triventures believe that we are on the verge of a new era of care, and we see digital health as an opportunity for cross-industry breakthroughs that converge the best-in-class in health and non-health technologies, such as InsurTech and FinTech for health, e-commerce and cyber for health, community-driven genomics, health data marketplaces, and more. We believe that patients will gain more and more power over their health, and that now is the time for consumer-centric, data-driven healthcare solutions that are designed to bend the cost curve of care and help us stay well.